You got on board before Apple, before Benioff at Salesforce, and said this matters. Why is Verizon that communicates, why is Verizon helping Lisa Sherman on messaging what we need to do on COVID?
This, as we all know, and as you mentioned in the beginning, this is unheard of pandemic, has hit so hard on this country and the rest of the world. And of course, one thing that is important, of course, the communication around it and raising the awareness and the science around the vaccine coming up right now. And we thought that when vaccine is coming out, we have a very big responsibility as a huge employer and as a big company to be part of that communication about the awareness and also about the science around it, especially for the most vulnerable in our society that hasn't gotten that information and that has been most hit by this pandemic. So for us, it was pretty natural to be a founding partner of it.
Lisa Sherman, my mother sold war bonds. This is a few wars ago, and that was started by the Ad Council in the 1940s. I grew up with only you can prevent forest fires, and now it's only you can prevent COVID. The Ad Council's been definitive in messaging America. How are you going to message education to get the courage to vaccinate in America?
Well, first of all, Tom, thanks for having me. We're clearly dealing with the biggest public health crisis in our lifetime, and we fundamentally knew at the Ad Council that we had to launch the largest public education effort in our history. So we've recently launched a massive coordinated communications campaign that brings in every sector in the economy. And our focus is really on trying to get people to have confidence in the COVID-19 vaccines, which, you know, the fact that we have them in such short order is nothing short of heroic. But at the same time, you know, what we're seeing is high levels of vaccine hesitancy. Just the data, probably pretty current, about 50% of people right now have either begun the process of vaccination, have at least one of the shots, or intend to get vaccinated. Yeah. On the other end of the spectrum, you've got about 15% of the people who say they're never going to get it. So our focus is really to talk to the 35% of Americans who, frankly, are taking a wait-and-see attitude.
Well, Lisa, can you tell us about the nature of that 35%? In other words, is there a unifying characteristic of individuals in the United States who don't want to get the vaccine?
You know, we've done a lot of work in trying to understand hesitancy, and it's pretty complicated and it's very nuanced. You know, it ranges from everything. People have a lot of questions and they just want answers to their questions. Some of it could be, you know, how did this happen so quickly? Did people trade off efficacy for speed? Others have longstanding concerns because of inequities, and especially in the Black and Hispanic communities, where there have been longstanding inequities in the healthcare community. So we see higher levels of hesitancy among Black and Hispanic communities. We also have begun to see more hesitancy among conservatives. These are folks who also have a lot of questions. And really, the common thread, I would say, Lisa, is that people don't want to be told what to do. They want the information. They want to be able to ask their questions. They want to feel empowered to make decisions for themselves and for their families.
So we go from the public health side to the business side, and Hans, there's a question of mobility in cities, of traffic to retail stores. You see the nexus of all of this, both with mobile data as well as your retail stores. Are you seeing people materially increase mobility as vaccinations pick up, or has it been slower than you would have otherwise expected?
It was a time in May, April last year, and we measure this sometimes on how mobile people are, is how they move in between radio towers. And it was down in some of the most urban places 60%, meaning people moved 60% less. They were staying home. That mobility is slowly coming back, and we have seen a clear improvement the last couple of months here, whereas the optimism are coming. But as we all know, the optimism is in the end of the tunnel, so we just need to see that we get through this first. But clearly, we see more foot traffic in urban areas, more mobility in urban areas right now.
Lisa, I want to go back to the branding of all this. You did this at Viacom for years. The idea of a mind is a terrible thing to waste. The Crying Indian ad campaign, which I remember clear as a day from Earth Day years and years ago. Can you just message now, or do you need celebrities? Dolly Parton has had the biggest impact so far. Miss Parton was out there with her COVID confidence. Do you need celebrities so Hans Vestberg is happy with your program?
Well, what I will say is, and I mentioned it at the top, trust is at the core of hesitancy. And so I think what we know and believe is that not only is the messaging important, but the messenger is also critically important. Who are those trusted messengers that each of these hesitant groups really believe and trust and feel comfortable with? And so for us, the common thread, again, another common thread to Lisa's question, is that medical experts are at the forefront. They're the number one. People want to understand from their doctor, their nurses, pharmacists, have they taken it? And then there are amplifiers, those people that can sort of help.
Well, Lisa, I don't mean to interrupt. Because of time, I think your observation is so important here. Franklin Graham set up a set of tents on Central Park outside Mount Sinai at the beginning of this. What do you need from the evangelical leadership away from the medical community to get evangelicals and conservative Republicans on board? What does the Ad Council need from Franklin Graham?
Look, we've engaged broad-based faith leaders who understand that this is not an either-or decision. You can have deep faith and believe that the vaccine can help you and free you to get back to life and keep your family safe.
Yeah. Hans, there's also a question about the faith in a better future, and we're looking at a way to track toward a modern era of tech prowess. And before we let you go, we have to ask about the infrastructure bill that Biden has put together and the 5G build out in the United States. What's your impression of what's laid out in the proposal as it currently is? How much will it help get 5G rollout in a smooth and consistent way across the United States?
As I think that 5G is an important piece of it, but I think that when we understand we have leapfrogged 5 to 7 years when it comes to digitalization in this country, telehealth, remote learning, and all of that, I think it's important to understand there's three pieces to solve the infra bill. Accessibility of broadband, affordability, and usability. And all these three needs to play together in actually to closing the digital divide that we now open with this leapfrog with one of the most sustainable technologies, mobility, broadband, and cloud. So I think that's what we are talking about and talking to the administration about, that we need to think holistically in order to solve the problem. It's not only one thing, but clearly 5G is an important piece of it. We are rolling out quicker than we have ever done before and more than we've ever done before, and we've increased our capex again. So this is an important piece for us.